Welcome back to the deep dive. Ready to dive into some research essentials for nurses?
Always ready. And judging by this stack of articles and research papers we have, it seems like we're in for a pretty deep dive.
Yeah, it looks like we're about to become like research ninjas or something.
Haha, I like that. Research ninjas. One thing that really jumps out from these sources is how much they emphasize that research isn't just this ivory tower thing.
Right. It's not just for academics.
Yeah, exactly. It's a tool, a powerful tool for nurses like you listening to make a real difference in patient care every single day.
I love that. I mean, let's face it, nurses are busy, like insanely busy. So finding time for research, it can feel pretty impossible.
I hear you, but that's exactly why learning how to ask the right research questions is so important.
Right. So you don't get lost down the research rabbit hole.
Exactly. And these sources, they all point to this PICOT method as a game changer. It helps you zero in on exactly what you need to know.
PCOT. Okay, I've definitely heard that acronym before. But honestly, I could use a refresher. What does it stand for again?
So PICOT stands for Patient or Population, Intervention, Comparison, Outcome, and Time. It's like a framework to really nail down the specifics of your research question.
Okay, I'm following so far, but can you give me an example? Like, let's say I'm a pediatric nurse, and I've noticed that a lot of my patients get super anxious before surgery. I'm curious about non-pharmacological ways to help them, but I don't even know where to start.
Perfect example. So your P, your patient population, would be children undergoing surgery. Your I, the intervention, could be, say, music therapy or guided imagery.
Okay, I see where you're going with this.
Then for C, the comparison, you could compare that to, let's say, standard pre-op care or maybe a different non-pharmacological
Oh,
approach.
right.
Bo is the outcome, maybe it's anxiety levels, how anxious the kids are or even how they're behaving, like if they're showing signs of distress. And then T is the time frame, so maybe the hour right before surgery or something like that.
So my PICOT question could be something like, in children undergoing surgery, does music therapy, compared to standard pre-op care, reduce anxiety levels in the hour before surgery?
Boom! You nailed it. You went from this general idea to a laser-focused research question.
That is so helpful.
Yeah.
Seriously. I feel like I could already breathe easier knowing I can narrow down my focus like that.
Right. And it saves you so much time when you actually start searching for evidence.
Speaking of searching for evidence, where do I even begin? Like, are we talking Google? Are there special nurse databases?
Well, Google's okay for like a super basic overview, but you really want to dive into some dedicated nursing databases. And CNIHL, the Cumulative Index to Nursing and Allied Health Literature, that's your gold mine right there.
CNAHL. Okay, so if I'm looking for, like, studies specifically about nursing interventions or patient experiences, that's my go-to.
You got it. But don't limit yourself to just CNIHL. PubMed is another huge database that has a ton of relevant stuff for nurses too.
Got it. CNAHL and PubMed. Writing these down. Now, I also noticed these sources mention something called gray literature. What is that exactly?
Oh, that's a good one. Gray literature is basically research and info that's not published in those typical academic journals. Think government reports, conference papers, dissertations, that kind of thing.
Hmm, interesting. So why should nurses care about gray literature?
Well, it can be a real treasure trove. You can find these unique perspectives and sometimes even preliminary findings that haven't hit the mainstream yet.
Ah, I see. So, like, I might find preliminary findings on, say, a new wound dressing in a conference paper, even before it gets published in a fancy journal.
Exactly. Great literature can give you a sneak peek at what's emerging, what's new on the horizon. It can also have data that's more localized, more relevant to your specific area of practice.
Okay, this is awesome. I feel like a whole new world of research is opening up to me.
Hmm.
But honestly, with all this info out there, how can I be sure what I'm reading is actually trustworthy, reliable?
That's the million-dollar question, right? And that's where those critical appraisal skills we talked about earlier really come in. You got to be a research detective.
Ooh, I like that. So how do I become a research detective? What are some of the clues I should be looking for? Like, are there any red flags that scream, this research is shaky?
Oh, yeah, definitely. First, look at the source. Is it a peer-reviewed journal? Is it a website from a reputable organization? Or is it just some random blog? That makes a big difference.
Right, so a peer-reviewed article from, say, the American Journal of Nursing is probably more reliable than something I find on, I don't know, like Nurse Betty blog.
Haha, yeah, probably. Now, another thing to check is the study design, and we'll dive into the different types later, but understanding the strengths and weaknesses of each design is key to evaluating the evidence.
Okay, source and study design. Got it. Anything else I should be watching out for?
Think about the sample size. Like, were there enough people in the study to make the results meaningful? And look at the methods. Did the researchers explain how they collected and analyzed their data? Does it all seem legit and appropriate for their research question?
Okay, so I'm looking for clear methods, a decent sample size, and a reputable source. Sounds like a good starting point.
Yeah,
What about the conclusions? Can I just take those at face value?
that's where the real detective work comes in. Don't just accept the conclusions blindly. Do they actually follow logically from the data? Are there any other possible explanations the researchers might have missed? Always think critically.
That's a great point. It's so easy to just assume that everything we read is accurate or that it applies to all of our patients.
Right. Critical appraisal is all about being an informed consumer of research. Taking a step back and asking, does this research actually hold up and how does it really apply to my patients and what I do every day?
This is eye-opening. Now, I know these sources talk about both quantitative and qualitative research. Can you break down the main differences for me? And why is it important for nurses to understand both?
Sure. So think of quantitative research as the numbers game. It's about measuring, analyzing, testing hypotheses. Like if you want to know if a new pain management protocol actually reduces pain scores, that would probably be a quantitative study.
So if I'm looking for research on how well a treatment works, I'd probably be looking at quantitative studies.
You got it. Qualitative research, on the other hand, dives into the why behind things. It's all about understanding people's experiences, their stories, the meaning they make of their health journeys.
So I want to understand how patients are coping with, say, a chronic illness. I'd want to look for qualitative research.
Exactly. You might do interviews or focus groups to really explore their experiences in their own words, their challenges, their coping mechanisms, all of that.
I'm starting to see how both types of research can be super valuable for nurses. It's like they each give us a different piece of the puzzle.
Exactly. And knowing both methodologies, both quantitative and qualitative, means you can evaluate a wider range of research and make better decisions in your practice.
Now, I noticed the sources also mention some specific types of studies, randomized controlled trials, cohort studies, and case control studies. Let's break those down, starting with RCTs. Those seem to be like the rock stars of research.
They kind of are. RCTs are often considered the gold standard for figuring out cause and effect. Basically, you randomly assign people to different groups, making sure the groups are as similar as possible, except for the one thing you're studying.
Okay, so like if we wanted to know if a new medication really works, we'd randomly assign patients to either get the medication or a placebo, and then we'd compare how they do.
That's the classic RCT setup. And that random assignment, that's key. It helps minimize bias, so we can be more confident that any differences we see are actually because of the treatment and not something else.
Gotcha. Randomization is key. Now, what about cohort studies? How are those different?
Cohort studies are more like observing what happens naturally. Researchers aren't controlling anything, they just follow a group of people over time and see what goes down.
So, for example, researchers could follow a group of kids, a cohort, from childhood to adulthood to see what the long-term effects of childhood obesity are.
Perfect example. They'd track things like health outcomes, maybe development of chronic diseases, that kind of thing. And they could see if there are any connections between childhood obesity and those outcomes.
But cohort studies can't prove for sure that one thing causes another, right?
Right. They can show associations, but not definitively prove cause and effect like RCTs can.
Okay, so we got to be careful about jumping to conclusions with those.
Right.
What about case control studies? How do those work?
These are kind of like working backwards. You start with people who already have a certain outcome, like a disease, and then you look back in time to see if there were any differences in what they were exposed to compared to people without the disease.
It's like a medical mystery. You're the detective trying to find the culprit.
Exactly. Like if researchers wanted to figure out risk factors for lung cancer, they might compare a group of people with lung cancer to a group without it and look for differences in things like smoking history.
That makes sense. So case control studies can be helpful for understanding what might increase the risk of developing certain diseases. Now, the sources also mention systematic reviews. What are those all about?
Those are like the all-star team of research. They basically gather up all the best available evidence on a specific topic. Think of it like a super-powered literature review.
Okay, so it's not just one study, but a whole bunch of studies combined to give us the big picture.
Exactly. And that big picture is super helpful when you're trying to make decisions about your practice. It can also highlight areas where we need more research.
I love that. So it's about seeing the forest and the trees.
You got it. Systematic reviews are a powerful tool for nurses who want to stay on top of the latest evidence.
Wow, this has been incredibly helpful. I'm feeling way more confident about understanding research and evaluating the quality of what I'm reading.
That's awesome. But remember, we're just getting started. The real magic happens when we take all this knowledge and actually apply it to our everyday practice.
Okay, now I'm really intrigued. How do we bridge that gap between research and what we do at the bedside?
That's what we'll dive into next time. Stay
I
tuned.
can't wait.
So, we've talked about how to formulate a good research question and then how to actually find the evidence, right? But that's not the end of the story.
Right, because just finding the research isn't enough. We have to actually use it.
Exactly. It's about making that connection between, what the research says and what you do at the bedside every day.
And that's where evidence-based practice, or EBP, comes in, right?
Yeah.
These sources, they talk a lot about EBP, but I feel like we need to unpack that a little bit. What does it actually mean for nurses in the real world?
Okay, so EBP is about taking the best available research evidence, combining it with your own clinical experience, and then factoring in your patient's values and preferences. It's a three-way street.
So it's not just blindly following research. We get to use our brains, too.
Absolutely, you're not robots. It's about using research as a guide, a roadmap, but also using your judgment, your experience, and most importantly, involving your patients in the decisions.
I like that. It's a partnership.
Exactly. Can you give me an example? Like, let's say you have a patient with chronic pain, and the research says that a certain type of exercise therapy can really help. But maybe your patient has some mobility issues that make that particular therapy tough for them to do.
So I wouldn't just ignore the research completely, right? I'd have to think about how to adapt it.
Right. You might modify the exercises or maybe consider a different approach altogether based on what you know about your patient, their limitations, their preferences.
It's about finding the best solution for that individual patient.
Exactly. One size doesn't fit all in healthcare, right? And that's where your expertise, that nurse-patient relationship you build, it's invaluable.
That makes me think about communication, how crucial it is in EBP. Not just talking to other nurses and doctors, but really communicating with our patients.
Oh, absolutely. Communication is at the heart of it all. You have to be able to explain those research findings to your patients in a way they understand, a way that makes sense to them.
Right. It's not just, hey, research says do this, but more of a conversation, explaining the benefits and risks, working together to decide what's best for them.
You got it. It's all about shared decision making. Patients need to feel empowered, like they're part of the process.
This is awesome. I'm starting to get really fired up about EBP. Now, another thing these sources talk about is disseminating research findings. What does that mean exactly? And why is it so important?
It's basically sharing what you've learned. And it's important because it helps move nursing practice forward. It's about spreading knowledge and making things better for everyone.
I see. So it's not enough to just read the research ourselves. We need to share it with others.
Right. Think about it. If a nurse figures out this amazing new way to manage a wound or to reduce falls or to, I don't know, help kids feel less scared before surgery and they keep it to themselves, that's a missed opportunity.
So many other nurses and patients could benefit.
Exactly. It's like having this secret weapon that could help tons of people, but it's just sitting in a drawer.
And there's so many ways to share research, right? Presenting at conferences, publishing articles, even just talking to your colleagues.
All of that. And don't forget about social media. That's a huge way to connect with other nurses, share interesting research, and get those discussions going.
That's so true. I follow some amazing nurse researchers on Twitter, and I learned so much from them.
It's a game changer, and it really highlights how nurses aren't just consumers of research, but also contributors. We're spreading the knowledge too.
I love that we're all part of this bigger movement to make nursing practice more evidence-based.
Exactly. Nurses at all levels, students, new grads, seasoned pros, everyone has something to contribute.
So whether I'm presenting at a national conference or just sharing a journal article with my coworkers, I'm helping to advance the profession.
You got it. Every nurse can be a research champion.
Okay, I have one more question before we wrap up. All these sources talk about understanding the limitations of research. Why is that so important?
That's a great question. It's important because even the best research has its limitations. Research is a process, it's ongoing, and each study just adds another little piece to the puzzle.
So it's about being realistic about what a study can and can't tell us.
Exactly. Acknowledging the limitations doesn't mean the research is bad or useless. It just means we need to interpret the findings carefully with a little bit of nuance.
Okay, so for instance, if a study only had a small number of participants, We can't assume that the results will apply to everyone.
Right. Or if a study was done in, say, a big city hospital, we can't automatically assume the findings will hold true in a rural clinic.
It's all about context.
Exactly. Critical appraisal, it's about understanding the strengths and the weaknesses of a study so we can make smart decisions about how to use that evidence.
I get it. So it's not about being negative or tearing down research. It's about being thoughtful, being aware.
Exactly. It's about being an informed consumer, so you can judge the quality of the evidence and make good decisions for your patients.
This has been such an incredible conversation. I feel like I've learned so much, and I'm excited to start putting all of this into practice.
That's what it's all about. Nurses, you guys are on the front lines. And when you embrace research, when you embrace EBP, it elevates everything you do. You're giving the best possible care, and you're advocating for your patients in the best possible way.
You've inspired me to really dig into the research and make it a part of my daily practice.
That's what I like to hear. Now let's go out there and make a difference.
Let's do it. All right, we're back for our final deep dive. I'm feeling pumped and ready to tackle some research articles.
Awesome. Let's do it. So now we're going to put all those critical appraisal skills we talked about into action. Remember, you're like a detective, examining the evidence, asking tough questions.
I'm ready to channel my inner Sherlock Holmes. But where do I even start with a research article? They can be so long and, honestly, kind of intimidating.
Don't worry, it's not as scary as it seems. First, just do a quick scan of the whole thing, the abstract, the intro, the headings, just to get the big picture.
Okay, so don't just jump right into the methods and results without getting some context first.
Exactly. The abstract gives you a nice little summary. The intro sets the stage, explains the research problem, and those headings help you navigate the study, see how it's structured.
Makes sense. Now, I know we talked about looking for red flags in research. What are some of those things that should make me think twice about the quality of a study?
One big red flag is if the research question or the hypothesis isn't clear. If you can't figure out what the heck they were trying to investigate, that's a problem.
So it all starts with a clear purpose, a clear question.
Right. Another red flag is if the study design doesn't match the research question. Like if they're trying to prove that something causes something else, but they used a design that can't do that, well, that's a problem.
It's like trying to bake a cake with a blender. You need the right tool for the job.
Perfect analogy. And speaking of tools, pay attention to how they measured things. Are the instruments they used reliable, valid? Did they clearly explain what they were measuring and how?
Because if the measurements are wonky, the whole study is kind of pointless.
Exactly. You also want to look closely at the sample, the people in the study. Was it a good representation of the population they were trying to study? Was it big enough to give us meaningful results?
Because a tiny biased sample can really mess things up.
Got it. And keep an eye out for bias and how they collected and analyzed the data. Did they do any blinding to prevent researcher bias? Were the statistical methods appropriate?
Wow, there's a lot to think about. I'm starting to realize that critical appraisal is all about being skeptical, not just taking the researcher's word for it.
Exactly. You got to think critically, question everything, evaluate the evidence with a discerning eye.
Now, you keep mentioning the importance of understanding a study's limitations. Can you explain that a bit more? Why is that so crucial?
It's important because, look, every study has limitations. Every single one. It's about recognizing that research is an ongoing process, and each study is just one piece of a much bigger puzzle.
So it's about having realistic expectations about what a study can tell us.
Right. Just because a study has limitations doesn't mean it's bad or useless. It just means we need to interpret the findings carefully. Be aware of the context.
Okay, so if a study has a super small sample size, I shouldn't assume the results apply to everyone.
Exactly. Or if a study was done in a very specific setting, like, say, a specialized ICU, we can't just assume the findings will apply to a general medical floor.
It's about understand the boundaries of the research.
You got it. Critical appraisal helps us see both the strengths and weaknesses of a study so we can make smart choices about how to use that evidence.
I'm starting to see how critical appraisal isn't about finding fault with research. It's about understanding it better, using it more wisely.
That's a great way to put it. It's about being a savvy consumer of research so you can make the best decisions for your patients.
This whole deep dive has been amazing. I feel so much more equipped to approach research, to critically evaluate it, to actually use it to improve my practice.
I'm so happy to hear that. Nurses are at the heart of healthcare. And when you embrace research, when you embrace EBP, you're raising the bar, you're advocating for your patients in the best possible way.
You've inspired me to make research a regular part of my professional life, to never stop learning and growing.
That's fantastic. And remember, this journey of lifelong learning, it never ends. Keep asking those tough questions, stay curious, and never stop looking for new knowledge to improve your practice.
To everyone listening, thanks for joining us on this deep dive into the world of nursing research. We hope you feel empowered to use research to elevate your practice and become champions for evidence-based care.
Keep learning, keep growing, and keep making a difference in the lives of your patients. That's what it's all about.